Hi there everyone, welcome to my monthly video chat where I sit down with the best and brightest of perinatal health professionals in the greater Boston area. For those of you who don't know, my name is Angela Bell. I'm an acupuncturist and I work in Cambridge, and I focus on treating women during fertility challenges, pregnancy, and any kind of women's health issues. Today I am sitting down with Heather Becton Hunt, and she is a massage therapist and a craniosacral therapist, and she specializes also in treating women during pregnancy, but also infants and their families. Hi Heather, how are you?
Hi Angela, I'm well. How are you?
Good. It's so great to have you here today.
Thank you so much for the opportunity.
Yeah. So I know I gave people just a really basic overview of what you do, but can you kind of fill in the gaps and give us a little bit more detail about what the services are that you offer?
Sure. So I work primarily with women during pregnancy and postpartum period, and I also doing massage therapy primarily, and also integrate craniosacral therapy into my treatments, and I work with newborns doing craniosacral therapy for them as well. So you kind of covered it in a nutshell.
Awesome. So I know one question that I always have had, and I'm sure that people watching this video will have, is like, what's the difference between pre and perinatal massage? Like, what are the things that you need to address that are different? How would it look different than, say, someone who wasn't pregnant or hadn't just had a baby who was coming into massage? Tell us a little bit about the difference.
Sure. So postpartum massage really needs only be different than regular massage in terms of the therapist's understanding of safe positioning, potential contraindications, and the impact that those contraindications have on whether a woman is able to receive massage or how she can receive massage. And understanding the changes of a pregnant woman's body, especially as her body progresses through the pregnancy, and what her body mechanics are going through, and how the effects that has on a woman's body, like how that affects her body systems, not only just muscularly, but structurally, and all the systems, respiratory, cardiovascular, nervous system, all of that, hormone regulation, and just how massage can affect all of those. So a trained and certified therapist will take all of those things into consideration. Whereas, maybe someone who's not, but who took a class and pregnancy massage, may be able to safely massage a woman's body, but may not understand all the nuances of what's going on. In terms of receiving massage, a pregnant woman can receive pressure. A lot of people come in and they say, oh, I had a massage, but it was very light and it didn't seem very effective. Pregnant women need to have their bodies worked in a big way. And so, people need not be afraid of applying pressure, appropriate pressure when necessary. So that doesn't have to be different, but it is the positioning, sideline positioning with support pillows is the preferred positioning, not the tables with the cutouts, although I know many women really love to lie on their bellies, but sideline is the preferred position, or in a semi-reclined position. So just understanding the safe positionings, contraindications, and all the effects that the mechanics have on the body.
Awesome. It's so exciting to be able to talk to someone who really specializes in treating pregnant women, because in my practice, I see a ton of people who are actively seeking out massage, and there are massage therapists who won't treat pregnant women. And I know that you and I have talked about this specific issue before about kind of the contraindications being a real barrier to women getting massage in general.
Sure.
And as an acupuncturist, I am very aware of what specific points and areas on the body could potentially increase contractions.
Right.
But can you talk a little bit about that whole issue, that women need not be afraid of that, and kind of what precautions you take and what you know about the body?
Sure. I love dispelling this myth.
Yeah, me too.
So, often women will say, "Oh my gosh, don't massage my feet," and
Right.
And obviously, it's true. There are points on the body that can stimulate uterine contractions.
Sure.
But again, a trained and certified therapist is going to know where those points are and know not to stimulate those points. And also, I think it's really important to know that these points can't be stimulated by accident. Like a therapist has to know where the points are and has to be intentional in trying to stimulate them, which takes time. You're not going to accidentally stimulate an acupressure point that stimulates the uterus by just going over it.
Exactly.
It takes time and intention to stimulate these points. So it really is not. It doesn't come into play in terms of just like a general massage. If someone thinks that they could possibly be done harm during their pregnancy by getting a massage, it's just not going to happen. Massage therapists don't utilize those techniques, so it's not an issue.
It's not an issue. I totally agree.
Yeah.
And as you know, I do that kind of work all the time, where women who are approaching their due date, or oftentimes beyond their due date, are really looking to get contractions going and labor started, in which case we can use very specific techniques to heavily stimulate those particular acupoints. And like you said, that's a very different thing than just like gently massaging the body, and that grazing over maybe that area in the body is just plain not going to be enough to stimulate contractions. And so it's, I think, a huge missed opportunity for women who, like we were talking before, really could use the body work during pregnancy, that sometimes people kind of mislead them or shy them away from getting that type of body work because they're afraid of the whole starting contractions issue. So
right.
Thanks for dispelling the myth.
Yes.
So what I wanted to ask is if we could talk about some specific stories, or at least story, of someone who came in during pregnancy where getting a massage was really helpful. I think that when people can hear really like case studies and patient or client stories, that they have a better ability to kind of relate to what's going on, as opposed to, us as practitioners, we just want to tell them like all the benefits of our services. So do you have a story of someone who's pregnant who came to you for help, and your services were able to help them?
So I had a client. I fall in love with my clients all the time. So one of my favorite clients, one of the many, I had a client come in, and she was about 5 months pregnant, and she was experiencing sciatic pain. And this was her first pregnancy. And she was, a little bit worried about like, oh dear, I have all this time to go, and I wasn't expecting this. And she was, having some significant pain. So I did a combination treatment with her, craniosacral therapy to align her structures and release her sacrum, and massage to relax the muscles in her low back and in her hips. I do a lot of hip work in my practice. So, to relax that area. And then also craniosacral also to help put her center of gravity in the proper place, because often women tend to like move forward, and that puts a lot of strain on their low back. So just the craniosacral helps to realign the structure, and so brought her center of gravity back, realigned the pelvis, and did massage for her low back and hips, and just relaxed that whole area and put it sort of more into a more optimal positioning for her current state. And so, it took probably about 3 sessions before she really felt about 98% better. But then she just continued to come through the rest of her pregnancy and did not experience any more pelvic pain or sciatic pain or any of that through the rest of her pregnancy. Went on to have a lovely birth and has a sweet little baby boy now, and so it was it's really wonderful when you are able to help someone
so fantastic
experience a happy pregnancy.
Yeah, it just makes all the difference for quality of life, because it's, people can experience sciatic pain for long periods of time during their pregnancy. And I think sometimes women just don't know that treatments are out there and available to really help with that sort of thing.
Right.
So awesome.
And two, I mean, I guess I should say prior to, I'm a real believer in the craniosacral work, and prior to learning that type of work, I, was only doing massage, and I would feel the frustration of massage not holding. And a combination of the craniosacral, like aligning the structures and releasing the ligaments and massage, really is more of a holistic treatment, and really has a very beneficial effect on helping treatments kind of hold well.
That's so great. Yeah, it's great that you can use them at the same time and like interchange as part of one whole treatment, as opposed to like you either have to get a craniosacral therapy session or a massage session.
Right. Yes, yeah. I love to combine them all the time. They really complement each other beautifully.
That's awesome. So I also wanted to ask, I know that there are occasions when sometimes you do either at home or in hospital visits. Can you tell me a little bit about that service that you offer, and like who could benefit? Like what are the instances where people really should consider like someone coming out to their home or coming to the hospital?
Sure. I mean, women get put on hospital rest or bed rest for a variety of reasons, and honestly, any time a person is on bed rest, it really should be considered. And the sooner the better, in terms of like cardiovascular flow. If a woman's on bed rest, she's not getting that cardiovascular flow that she needs in her legs, although most hospitals do have DTs that will come and help to exercise the legs. But it really is beneficial, not only just physiologically, but also emotionally and mentally, for a woman to have something to look forward to.
Yes.
And especially if she's at home, to have, social interaction and someone coming and caring and interacting with her during the day. It can be a very lonely and isolating and stressful time, especially if there are other little children in the house. But so really, honestly, any time a woman is on bed rest or hospital rest, it would do her a world of good to have some treatments during her time. And otherwise, I would say it's, primarily for people who want to experience massage in their home. It's a luxury, but really for people who are on bed rest or hospital rest, it's very beneficial and in my opinion, essential.
I totally agree with you. And I think for this particular issue that we're talking about for bed rest, people don't think to consider it. And it's just what a huge value to be able to have this, either one, in the hospital or at home, to have someone come to your home and really work with you in regards to body work. It's just a huge, huge gift to yourself.
Absolutely. Yes.
So then my next question is about combining craniosacral, and do you do that with massage for infants? Like when you're working with infants, do you tend more towards massage or infant massage? Do you trend more towards craniosacral? Or is it the same with adults where you really tend to integrate them together?
So with infants, it really is, I would say, 99% craniosacral therapy. I do teach infant massage to parents and caregivers. But infant massage is more, it isn't only about massaging a baby's body, but it is about bonding and connecting. And I want the baby and the parents to be bonding and connecting. So I teach them how to do that work. And craniosacral therapy is very subtle, and parents can be taught, but it takes, it can take a lot. So usually that's the work that I primarily will work with an infant to do. Usually I split it up where I'm just doing craniosacral, and I let the parents do the bonding and connecting through massage.
Cool. That makes good sense.
Yeah.
So can you give us an example of when someone came in for, or when would you recommend someone come in for craniosacral work for their infant? Like, how would a new mother know that craniosacral work or being taught massage would be appropriate for them and their baby?
So I really believe that every child should have a craniosacral treatment after birth.
Me too.
I think that it would benefit everyone. But babies' bodies are so open and receptive to body work, and it can just be very beneficial in helping them to release any soft tissue or structural compressions, soft tissue restrictions or structural compressions that they may have due to in utero positioning or the birth process, no matter what the type of delivery was, whether vaginal or cesarean or anything. Babies come out many different ways, and that can have a variety of impacts on their bodies. So I, believe that a baby receiving craniosacral as soon after birth as possible would be a great thing for all babies. And so a general wellness visit is great and very beneficial. Other issues where people, say, oh, what's going on here, and wonder if craniosacral can be helpful are babies who are having digestive issues, babies who are having nursing issues. Craniosacral is very beneficial in helping babies who are having issues nursing, whether it's like opening wide enough or the suck not being strong enough, a variety of issues around nursing. Sometimes it's a soft tissue restriction in the neck where a baby just can't turn their head enough to latch on. It's a variety of things around nursing, so very beneficial for that. General nervous system issues as well, like a baby who's too aroused, who can't let their system come down and go to sleep, or the flip side, babies who are just too sleepy, who can't rouse and can't seem to wake up, so to speak. So a variety of reasons can a mom or dad say, craniosacral for babies is extremely gentle. I just want to say that it's very, very gentle, subtle work. It almost feels like you're not doing anything because you're applying such light pressure, just allowing the body, holding where you find restrictions and allowing the body to open. It's not any sort of forced using force at all. It's very, very gentle and easy for babies. And like I said, their bodies are so open and receptive.
They're so ready for it.
They tend to just open, and it's beautiful work.
I love watching babies get treatment because oftentimes they just kind of melt into it.
It's amazing how, a baby born and they're like this, and it's amazing when you do work how much they just unfurl.
I think it's so fun. I don't work with infants, but I love seeing infants getting treated because it's just, like you said, they open right up to it and their bodies are so receptive, and it's so, you can make such a big impact with just a tiny bit of treatment. It's really wonderful.
Yeah.
So now we're talking about babies getting treated and how it can be hard on them to be born. And so what about moms? Once the baby arrives, I know in my practice it's often tricky to get moms to pay attention to themselves because now they have this new baby that all of their focus is on. But turns out they need treatment too. So I know you do work with moms once the baby has come. Can you do you have a story that you could share about someone who would have received postpartum massage or craniosacral that it was beneficial for them?
Sure. I had a mom come in yesterday. She is 2 weeks postpartum, and she came in saying that she had some pelvic floor discomfort, not pain, but just kind of didn't feel right in her pelvis. Understandably so, it's vaginal delivery. And she was also having some neck and shoulder, soreness and pain. And so I, again, combined craniosacral and massage, and I did a pelvic realignment with her standing, and then also did some pelvic release work using craniosacral with her on the table, and did some massage for her neck and shoulders and her arms, and did some pec work kind of opening up because, nursing moms are like this, and you're holding you're rocking and you just sort of round in. And so I did some work to kind of open her chest up a little bit and really worked on her arms. And she commented afterwards that, she felt more stable and that she didn't realize how much tension was in her arms. And while I was working on her, she was like, oh, I can see how that is affecting my neck and shoulders.
Right.
And so I think that was really helpful for her to make the connections and just to feel better in her body.
Absolutely. And when she feels better, she can better care for the baby. Everybody's quality of life is better.
Absolutely.
Yeah.
Yeah. And I also, for moms postpartum, a trained therapist is going to know that we don't do work on the legs for, the first 8 weeks or so postpartum. So that kind of works with Mother Nature. The issues go from being typically lower body weight-bearing kind of issues in the hips to upper body issues due to all the holding from caring for a baby. And so, the work just shifts to the upper body typically. And so, it kind of, it works. It works right with Mother Nature, but we don't do work on the legs postpartum. And I just like to make sure that that's out there.
Well, it's good. And that's reason number 100 why people really should, when they're in the perinatal stage of life and they're either preparing to have a baby, they're pregnant, or they've just had a baby, really go to somebody who's trained in that kind of work specifically.
Yeah.
So, given that you've worked with so many pregnant women, is there one specific thing you wish pregnant women knew about your services?
Think about that. I think just that it's important to find someone that is trained, that it's safe to come in. Typically, I tell people, I don't think that there's one thing. I can't find one thing to say.
That's okay.
To say. But prenatal postpartum massage is safe in the hands of a capable practitioner.
Yeah.
And it's possible to, if you have the resources and the time, to come. I typically like to tell people to come like they would schedule their prenatal visits with their care provider. That spacing tends to work. So it's a little less in the beginning and then more frequently towards the end. Some people need to come more often depending on what's going on for their individual body. But sometimes I often get asked, how often should a woman come for prenatal work? That's a good rule of thumb.
Yep.
And it's safe to come as soon after birth as a woman desires to have body work, unless there's some medical issue that, is presenting itself, some contraindication. But otherwise, you can get massage as soon after giving birth as you wish. And I often tell women, you can bring your baby. You can bring your baby in the office. I have nursing pillows and have nursed on the table and given mom massage while she's nursing. Usually the babies just sleep in their seats, and then other people will bring a caregiver and have the caregiver sit with the baby in the lobby, just so mom can be close by if she's needed, and that's perfectly encouraged and allowed in my practice.
That's so great. And then my final question to you really is that I find that so many women during pregnancy are looking for books to read, and there are so many great books available. Do you have any favorites that you recommend?
So, I would say my favorite is Birthing from Within. And the reason that I like it is because it empowers a woman you can take different childbirth classes, but that book I find really empowers a woman to draw her strength from inside of her and to do work going through her pregnancy, and not only preparation for the labor, but also it's a transformation. Pregnancy is a transformation, becoming a mother, and so all of that work throughout the pregnancy and preparation for birth and becoming a mom. I feel like that book is really empowering and encouraging for women to, find their inner strength instead of, books can be a great resource, but can also, be confusing, or,
Yes.
read different things. And that, I feel like, really draws on the power inside of a woman to be herself, and to go through the process and transform into the mom that she's going to be.
I love it. That's awesome. Well, thank you so much for today. The only other thing I want to ask of you is to tell us how people can find you, where you're located, and how to get in touch if they are seeking massage or craniosacral work for themselves or for their infants or in their families.
Oh, yes, of course. So my practice is located at 742 Mass Ave in Arlington, right in the heart of Arlington Center. And I have a website people can visit if they want to learn more. It's heatherbectonhunt.com. And that's BECTON Hunt, HUNT.com. And my phone number and my email address are on my website, and people are encouraged to call with any questions. I'm happy to talk to people anytime and answer any questions regarding either massage or craniosacral visits.
Great. Fantastic. Well, thank you so much. I feel like we communicated a ton of really important information for folks, and we dispelled a bunch of really great myths. So thank you again for being here, and I'll talk to you soon. Have a great afternoon.
Oh, thanks, Angie. Thank you so much for having me. I really appreciate the opportunity.
My pleasure. Take care.
All right. Take care. Bye-bye.